Hello, I am Marwan AbouRass. In this session, I move to the third type of tooth surface wear, a condition more serious than abrasion, with profound consequences on both oral health and endodontics. The title of this presentation is From Abfraction to NCCL, Endodontic Implications and Clinical Management. So traditionally, the term abfraction was used to describe stress-induced microfractures in the cervical zone of teeth. This narrow concept has evolved during the past 2 decades. Today, we recognize these lesions as Non-Carious Cervical Lesions, NCCL, a multifactorial pathodynamic process occurring at the cemento-enamel junction, very often involving entire quadrant of teeth, not a single tooth. And by reaffirming the discussion of from abfraction to NCCL, we really are now doing patient-centered care, preventive care. The presentation will show the various stages on NCCL, highlighting their clinical features, patterns of involvement. You will see how these lesions progress and how their presentation differ from one form to another, one stage to another. To deepen our understanding, I will review the major theories on the etiology: compression and flexure, tensile stress, microfracture, multifactorial pathodynamic mechanisms. All are important theories to explain the NCCL. And then I will focus about the endodontic relevance. I will add my own contribution, the importance of anatomy, abnormal anatomy at the cemento-enamel junction. And then if these lesions need endo, I'm going to introduce the BioSeal stress-free root canal treatment protocol. This protocol, which I use in these cases and cracked teeth, minimize stress, preserve the cervical dentin. It's stress-modified, conservative root canal preparation, stress-free canal obturation, and a fiber-reinforced composite to stabilize the tooth. Very exciting technique, which I have been using, and I'm going to show cases. It's very important to know these changes that we have from abfraction to NCCL. And that's what I have selected the material, and I'm sharing it with you. So what once called abfraction is now much better understood as a multifactorial condition. And it is very tied to pulpal health and long-term survival of the tooth. By recognizing these lesions early, applying precise diagnostic protocol, the 4ROD, we can protect the tooth, especially because these lesions are involving quadrants. I have treated patients with almost all maxillary teeth were involved. So it's not like abrasion, the canines and premolars. These are serious lesions. Speaking about from endodontic perspective, the clinical crown is intact, but the cervical zone is gone. Gone all the way to the pulp. And that's why I'm focusing on this issue in this presentation. Thank you for listening.